All right, let's dive into this. The opioid epidemic. I got to say, you've given us a really fascinating set of sources this time.
Oh, yeah. Yeah.
Yeah, there's like historical stuff and then the hard science too.
Yeah.
And it looks like there are even some bits from an actual college course about substance abuse.
Interesting. Yeah, having that historical context along with the science, the data,
Yeah.
it's super valuable when you're trying to understand something this big and complicated, this kind of public health crisis.
For sure. Like, just reading through the sources earlier, I came across this thing about how opium, like straight up opium, used to be seen as this cure-all even on battlefields. Kind of wild when you think about how we view opioids today.
Yeah, no, totally.
Do you think that historical perspective, like knowing how differently it was viewed, is important for us to like really grasp what's going on now?
Absolutely. I mean, just knowing how widely accepted opium was, even embraced, it really helps us understand how these changes in how society sees things and the advancements in science can sometimes lead to stuff we don't expect, even bad stuff.
So basically, it wasn't always seen as this like evil substance. Was there a specific moment or event that kind of flipped that perception?
Well, there was a big turning point when they were able to isolate morphine from opium
When was that?
back in the 1800s.
Oh, wow.
It was a huge breakthrough for pain management, but it kind of concentrated the addictive part too.
Yeah.
And then later on, when they developed those synthetic opioids, things like heroin,
Oh, yeah.
well, that really, I mean, it just opened the floodgates, widespread use, and sadly, abuse followed.
Makes sense. So we went from opium being this relatively harmless cure-all to, well, creating these much stronger and addictive substances. Did people start freaking out then, or was it more of a gradual shift?
It was a slow realization, kind of like a slow burn, with those moments where people suddenly realized just how dangerous these substances were. But it was in the late 1990s, really, when things sped up.
How so?
Well, pharmaceutical companies, they started marketing opioid painkillers really heavily,
Hmm.
downplaying how addictive they could be.
Oh, so that's when things really took a turn for the worse, right?
Sadly, yeah. A lot of doctors, they were reassured by those marketing campaigns, so they started prescribing these medications a lot more, maybe too much. And since nobody was talking about how addictive they were, well, people started misusing them, getting addicted, and in the end, overdosing. It's really the start of what we now call the opioid epidemic.
Kind of mind-blowing, right? Like
Mhm.
marketing campaigns and what the power of persuasion playing such a big role in creating this massive crisis.
It really is.
So let's break it down a bit. When we use the term opioids, what exactly are we talking about here?
So when we say opioids, we're talking about a whole range of stuff, both legal and illegal. Obviously, we have heroin, but also all those prescription painkillers, like oxycodone, hydrocodone.
Oh, okay.
People probably recognize the brand names more, like OxyContin and Vicodin.
Right. Which honestly makes it all even more confusing, don't you think?
Yeah.
You have these substances being prescribed by doctors, used in hospitals, but they also carry this huge risk of addiction.
Huh.
It's kind of hard to wrap your head around.
For sure. That whole legal and medical context, it just adds another layer of complexity to this whole issue. And it makes it hard for people to grasp how dangerous they can be because in their minds, they're thinking, well, if my doctor prescribed it, it can't be that bad.
Right, exactly. It's like a false sense of security.
Yeah.
And sadly, as we know, that's not always the case. In fact, one of the sources you sent over, it was an excerpt from a college course. And they mentioned that something like 2.1 million people were diagnosed with opioid use disorder in 2016 alone.
Yeah.
That's a lot of people.
It really is. And it's important to remember that's just a snapshot in time, like a single point.
Oh, okay.
To really get a handle on how big this epidemic is, we need to look at how it's changed over time.
Okay, so how has it changed over time?
Have you ever heard of the CDC's three-wave model of the opioid crisis?
Yeah, I think it was in one of those government reports you sent.
Right, yeah.
Could you break that down a bit?
Sure. So the first wave, wave one, started back in 99, and it was all about those prescription opioids, those deaths from them, all fueled by that overprescribing we talked about. Then, around 2010, we saw wave two pop up. That one was all about heroin, a sharp rise in deaths from heroin.
I'm guessing that's because heroin was cheaper and easier to get than those prescription opioids, right?
Exactly. People who were already hooked on the painkillers, they started looking for something cheaper, something easier to get their hands on. And a lot of times that was heroin. But the problem is street heroin, it's not exactly consistent.
Right.
The purity, how strong it can vary a lot, and that just made overdoses even more likely.
So each wave is like building on the last one, making everything even harder to deal with.
Yeah,
So
unfortunately.
what about wave 3? What was that all about?
Wave 3, that one started around 2013, and it was marked by a really scary surge in the use of synthetic opioids,
Oh, okay.
mainly fentanyl.
Right, fentanyl. That's the one that's
Mm,
like crazy strong, right?
yeah. Yeah.
I remember reading that even a tiny amount can be lethal.
Exactly. Fentanyl can be up to 100 times stronger than morphine.
Wow.
And what makes it even worse is that it's often mixed into other drugs without people knowing.
Oh, that's
It
terrifying.
really is. And that's
Yeah.
led to a huge number of accidental overdoses. This wave has been especially bad. The CDC, they reported that between 1999 and 2019, an average of 136 Americans died every single day from an opioid overdose.
Wow, 136 every day.
Yeah, that's almost 500,000 deaths in total.
It's hard to even imagine a number that big.
Right.
It's just incredibly sad. And of course, each of those deaths, that's a person, a family, a whole community that's affected.
Yeah, it's a huge loss. And I think to really grasp how powerful these drugs are, how addictive they are, we need to understand the science behind them, how they work on the brain and the body.
Okay, so let's dive into that. How do they work? I know they block pain, but what's the actual mechanism behind that?
So, opioids, they work by interacting with certain receptors in the brain and nervous system.
Okay.
These receptors, they're involved in regulating pain, but they're also involved in things like pleasure, breathing, a whole bunch of really important functions.
Hmm.
When opioids attach to those receptors, they basically block pain signals from getting to the brain.
Okay, so that's how they stop the pain. But it's not just about pain relief, right? There's that whole euphoric effect that makes them so addictive.
That's right, they trigger the release of dopamine.
Dopamine, right.
It's a neurotransmitter that's all about pleasure and reward. So you get this flood of dopamine, and that creates the feeling of euphoria that people chase, and ultimately what gets them hooked.
So it's this like feedback loop, right? The brain wants that good feeling, and over time, it needs more and more of the drug to get the same effect.
Exactly. That's addiction in a nutshell. And it's not just about the brain wanting to feel good, the body starts to physically depend on the drug too.
Which brings up something that I think is really important to clarify. One of the sources talked about this too, the difference between tolerance, dependence, and addiction. Those terms get thrown around a lot, and I think people get them mixed up.
Definitely. So, tolerance, that happens when a person needs higher and higher doses of a drug more frequently, too, to get
Mm.
the effect they want.
Okay.
It happens because their body adapts to the drug, essentially building up a resistance to it.
Hmm.
Dependence, on the other hand, that's when the body gets so used to the drug that, well, when you stop taking it, you get withdrawal symptoms.
Okay, so those are two different things. And then addiction is what, like a combination of both?
Addiction is a lot more complex. It's a chronic disease, a relapsing disease. People who are addicted, they compulsively seek and use drugs, even though it's causing them harm and harm to the people around them. It's a really complex mix of biological, psychological, and social factors.
So even someone who's taking opioids as prescribed by their doctor for real pain, they can still become dependent.
That's the tough part. They can, yeah.
Oh,
And it really highlights how important it is for doctors to be careful, to only prescribe these drugs when they're absolutely necessary, and to really talk to their patients, explain the risks honestly, especially the potential for dependence.
yeah, like walking a tightrope,
Mhm.
managing the pain effectively while also making sure people don't become dependent or
All
addicted.
right.
Maybe that's a good place to pause for now. Save that discussion for part 2 of this deep dive.
I think that sounds good. We've covered a lot of the basics, the history, how the crisis has evolved, the basic science of opioid addiction.
Yeah, I think we're ready to move on to the real world implications, what's being done about all this.
Exactly.
We'll be back in a moment to continue exploring this complex issue. Okay, so welcome back to our deep dive on the opioid epidemic. We've covered a lot of ground so far, like the history, how these drugs affect our brains, how
Mhm.
addictive they are. But now I'm thinking we need to shift gears a bit. Look at how this crisis is playing out in communities, what people are doing to deal with it. What do you think?
Yeah, absolutely. It's important to remember, zoom out a bit because the opioid epidemic isn't just about, individual people and their struggles. It affects entire communities.
Right, for sure. Like one of the sources you sent over the college course on substance abuse, they talked a lot about the role of community health workers.
Right.
They seem to think they play a pretty big role in addressing this whole crisis? What do you think?
I totally agree. I see them, honestly, as the unsung heroes. They're on the front lines, battling this thing every day. And they have these deep connections to the communities they serve. They understand the local context. They can build that trust with people who might not trust traditional healthcare.
Yeah, that makes sense. It's like they're bridging that gap
Mm.
between the medical professionals and the people who are really feeling the effects of this crisis.
Yeah, that's a great way to put it. They can connect people to treatment, help them navigate the healthcare system, which can be really complicated, and, just provide ongoing support.
Yeah. The course material also mentioned early intervention, how important it is, like catching those signs of opioid misuse early on before it turns into full-blown addiction.
It's huge. I mean, it's absolutely critical because community health workers, they're often in a position to see those warning signs, before anyone else, whether they work in healthcare settings, community centers, even just through everyday interactions in the community.
So they're kind of like those canaries in the coal mine.
Yeah, you could say that. They see the subtle cues that others might miss. And because they've got those relationships in the community, they can start those tough conversations, express their concerns and encourage people to get help before it gets out of control.
Yeah, it's like catching a falling knife before it, does too much damage.
Exactly. And their role goes beyond just spotting the problem.
Oh, okay.
They also educate community members about the risks, dispel those myths, and promote harm reduction strategies.
Harm reduction. We touched on that briefly earlier, but maybe we could delve into that a bit more. Like, what exactly does that mean when we're talking about this crisis?
So harm reduction, it's a public health approach. And the goal is to reduce the negative consequences of drug use.
Mhm.
But it doesn't necessarily require, total abstinence.
So it's about like meeting people where they are and offering practical ways to stay safer
Hmm.
rather than being, judgmental or punishing.
Right, exactly. It's about acknowledging the reality of drug use and finding ways to make it less dangerous.
Can you give us some examples of harm reduction strategies? Like, what does that actually look like in practice?
Sure, so needle exchange programs, that's a classic example. They provide clean needles to people who inject drugs. So it reduces the risk of spreading things like HIV and hepatitis C.
Right, right. And I've heard about those supervised consumption sites where people can use drugs, but they're, under medical supervision just in case of an overdose.
Yep, those are becoming more and more common in some places. They offer a safe, clean environment, which reduces the risks of using alone, and often they connect people with treatment resources.
They sound controversial, but if they're saving lives, well, I guess it's hard to argue with that.
They definitely are controversial, but the evidence is pretty clear. They really do reduce overdoses.
Yeah. Okay, so we've talked about prevention, reducing harm, but what about treatment? Like, for people who are already struggling with addiction, one of the government reports, it talked about something called medication-assisted treatment, or NAT. Is that a common approach these days?
Yeah, MATs it's a key strategy. It combines medication with, counseling and behavioral therapy.
Correct.
So you're addressing both the physical and psychological parts of addiction.
So medications like, what was it, methadone?
Methadone, yeah, or buprenorphine.
Right. I've heard of methadone clinics.
Mhm.
How do those medications actually work?
So these meds, they interact with the same opioid receptors in the brain as, say, heroin or prescription painkillers.
Okay.
But they do it in a way that reduces those cravings and withdrawal symptoms, but without producing that euphoric high.
So it's kind of like hitting pause on the whole addiction cycle,
Yeah.
giving people a chance to, stabilize and then work on the underlying issues.
Yeah, that's a good way to think about it. It levels the playing field, gives them a fighting chance to really engage with therapy.
Yeah. Makes sense.
Yeah.
But I imagine there are still a lot of challenges, right, when it comes to actually getting men up.
Unfortunately, yeah, there's still a lot of stigma, even within the medical community, and among the general public.
Oh, right.
Yeah, some people see it as just replacing one addiction with another. They don't really understand the science behind it, how it's supposed to work, what the goals are.
So we're back to that stigma again. It seems like a huge roadblock at every step of the way.
Yeah, unfortunately. And it's something we really need to tackle. We need to educate people, change those misconceptions, and push for policies that make it easier for people to get treatment, without being discriminated against.
Yeah, for sure. And I imagine there are practical barriers too, right? Like cost, insurance coverage, finding the right provider.
Absolutely. All very real obstacles. We need more affordable treatment options. We need to expand insurance coverage for substance use disorders. And we need to make sure healthcare providers have the right training in, evidence-based addiction treatment.
It's like we need to build a system that helps people recover, not one that punishes them for asking for help.
Yeah, I totally agree. We need to move away from this model of judgment and punishment and embrace one of compassion, understanding, and, care that's based on science, on what actually works. We need to meet people where they are, address their needs, and give them the support they need to get on that road to recovery. It can be a long road.
Hmm. I think this is a good place to stop for now. Wrap up part two. We've covered a lot, but I feel like there's still more to unpack. What do you think?
Yeah, I think for part three, we can zoom out even more.
Okay.
Look at those bigger societal factors that contribute to this whole epidemic and talk about some more potential solutions, beyond what we've already touched on.
Sounds like a plan. We'll be back in a moment to conclude this deep dive. Okay, so here we are, the final part of our deep dive into the opioid epidemic. We've talked about the history, the science behind it, the impact it's having on communities. But now I'm kind of thinking about the bigger picture. Like, throughout this whole conversation, I've been struck by how this crisis is not just about, like, bad choices or a lack of willpower. It feels like there's something deeper going on, like bigger societal forces at play. What do you think?
You're absolutely right. The opioid epidemic is really tied up in all these broader societal issues.
Like what?
Well, poverty, inequality, trauma, lack of access to healthcare, education, good jobs,
Right. Yeah.
all those things play a role.
Yeah, it's like a perfect storm. And it's funny, I'm thinking back to that thing we talked about earlier from that college course, how opium was seen as a cure-all for centuries.
Hmm.
Makes me wonder if maybe, as a society, we've just become way too reliant on, like, quick fixes and medical solutions for these really complex problems.
It's a good point. We've gotten so used to just popping a pill for every little thing. We want to medicalize every human experience. And don't get me wrong, pain management is important.
Oh, for sure.
But so often, we're just masking the pain. We're not actually dealing with the root of the problem.
Right, exactly. It's like, instead of asking what hurts
Hmm.
and how do we make it stop hurting, we should be asking, why is there so much pain in the first place?
Right.
And how can we fix that? You know?
Yeah, we need a more holistic approach for sure. One that looks at all the social, economic, environmental factors that contribute to suffering.
And speaking of, things that contribute to suffering, I can't help but think about the pharmaceutical industry and, their role in all of this. The course material touched on that too.
Mm-hmm.
Like those aggressive marketing campaigns for opioid painkillers back in the 90s, downplaying the risks, hyping up the benefits.
That definitely played a part in setting the stage for the crisis we're seeing today.
Mm.
Putting profits ahead of patients' well-being, not enough regulation, not enough oversight.
Right. It was a recipe for disaster.
It's frustrating. But I guess it shows that we need to hold those companies accountable,
Mm-hmm.
and we need stronger regulations to prevent this from happening again.
Absolutely. We need to make sure medications are being prescribed responsibly, that patients understand the risks, and that we're exploring other ways to manage pain besides opioids.
Right, right. Speaking of other ways to manage pain, one of the government reports you sent, it mentioned this shift towards a multimodal approach. Can you tell us more about that?
Sure. So with multimodal pain management, you're using a bunch of different therapies and interventions.
Right.
You're not just relying on opioids.
Oh, okay. So, like, what kinds of things?
Well, it could be physical therapy, massage, acupuncture, even mindfulness techniques, cognitive behavioral therapy.
Interesting.
There are a lot of options.
As it's about recognizing that pain is complex.
Exactly. It's not just physical. There are psychological and social components too. And your treatment should reflect that.
Yeah, it's like a more personalized approach.
Yeah.
Instead of that one-size-fits-all mentality.
Right.
It feels like we focus so much on what's going wrong. It's, it's pretty heavy stuff.
It is.
But it's important to remember that there's hope, too, right? There's more awareness now than ever before.
Yeah.
And people are more open to harm reduction strategies. We've got medications that can actually help people who are addicted.
You're right. There are definitely some bright spots. We're starting to have a more compassionate and scientifically sound approach to dealing with this crisis.
Yeah, exactly. And one thing I'm really encouraged by is the focus on trauma-informed care. Because a lot of people who are struggling with addiction, they've been through some really tough stuff, And if you don't deal with those underlying wounds,
Yeah.
those traumas,
Yeah.
well, recovery is going to be that much harder.
I completely agree. With trauma-informed care, you're acknowledging the impact that trauma has had on someone's life, and you're creating a safe, supportive environment for healing to happen.
Right. So it's about recognizing that addiction, it's often a way of coping with pain, with trauma.
Exactly.
And it's about meeting people with empathy, not judgment.
Exactly. It's about empowering people to take back control of their lives.
I think this deep dive has been, well, it's been eye-opening for sure. But I also feel this sense of urgency now,
Yeah.
Like, what are the most important things we need to do as a society to really tackle this thing head on? What needs to happen?
Well, we need to keep raising awareness, challenging the stigma, and fighting for policies that support prevention, treatment, harm reduction, recovery.
So it's not just about individual actions. It's about, like, changing the system itself.
It's both, really. We have to address those root causes like poverty and inequality and lack of access to healthcare, hold the pharmaceutical industry accountable, invest in research, find non-opioid ways to manage pain. And we need to create a more supportive environment for people who are struggling.
That's a lot to take on.
It is. But I believe it's possible. We've already made progress. And if we keep working at it, working together, we can turn this thing around. We can beat this epidemic.
This has given me a lot to think about, for sure. Any final thoughts you want to leave our listener with? Something to ponder as we, wrap things up?
Just, stay engaged with this issue. Learn more about it. Talk to people about it. Challenge the stigma. Support those organizations that are doing the work on the ground. Every action, every little thing you do can make a difference.
Well said. And on that note, I think it's time to wrap up our deep dive into the opioid epidemic. Thanks for joining us on this journey. We hope you've learned something new, that you feel hopeful, and that you're ready to be part of the solution.